Hi, I'm Scott Silverstein. I'm a pulmonologist in practice for 25 years in Lancaster County. 21% of adults in the United States smoke. Approximately 4,000 new smokers between the ages of 11 and 17 occur each day. In Lancaster County, we are fortunate to have only about 13 to 16% of people smoke, but we have an increasing amount of adolescents who are smoking. These are extremely important individuals to get to. There are about $96 billion in direct and indirect costs each year directly attributed to tobacco smoke, and directly causative action over 23 different disorders and diseases, and over 435,000 deaths directly due to tobacco. It's extremely important to realize that tobacco is a chronic, relapsing, and remitting disorder of nicotine addiction. It's extremely important to understand that there's a wanting, a needing, and a craving, all due to something called the latency of withdrawal. When we look at that, we look at how long until after they stop smoking, do they have a need or an intense feeling to want to start smoking. At age 16, if you've been smoking for 6 weeks, the latency of withdrawal to feel like you want a cigarette is 2 days. By age 16 and a half, if you continue to smoke, that drops to 4 hours. By age 17, 2 hours. By age 18, an hour and a half. By 19, an hour. And by age 21, the need and desire to smoke cuts down to 30 minutes. Again, it's important to understand that this occurs due to stimulating receptors in the brain, neurotransmitters called dopamine. There's an area in the brain called the mesolimbus in the midbrain, and a small area called the ventral tegmental area that's a collection of these neurons that, when stimulated by dopamine, leads to a tremendous increase in both security, safety, and satisfaction. Those are 3 extremely important things that drive you to feel good. And when you lose those things and they're not stimulated by nicotine and you're not stimulating dopamine, those senses are all lost. And that's what leads to the remitting and relapsing nature of tobacco abuse. This can be weeks, months, and even years after stopping smoking. Nicotine is more addictive a substance than heroin and cocaine and alcohol, all 3. When looking at tobacco as a chronic relapsing disorder, it's important to understand over the course of a year, 70% of people think about quitting. 44% of people try some attempt to quit, but only 4 to 7% of people are successful. What are things we can do as physicians to break that? It's extremely important for people and physicians to understand they need to talk to patients on how to stop smoking. Even 3 minutes of time can make a big difference. Unfortunately, physicians need to be more empathetic. They need to realize that tobacco is a chronic, relapsing, addictive disorder, and they need to be better trained on nicotine replacement treatments and on medications and on therapies designed to understand smokers and the best way to help get them to stop.